Balcony, we also believe that an efficient and affordable healthcare system that's accessible by all of our fellow Americans is great for the nation's collective soul. If you look in your package, you'll see that Balcony some years ago adopted 7 principles of healthcare reform, 3 of which I just mentioned to you. We're very proud to be here today with the Secretary, and it is truly my pleasure to introduce you to our country's leading health official, Secretary of the Department of Health and Human Services, Kathleen Sebelius. When you look, that's not quite enough of an introduction because she's doing so much more than just health. When you look at what our Secretary is doing, she's going so far beyond just health. She is reaching in a very important way into other key issues that we face, including improving childhood education, improving the lots of our seniors and disabled people. I don't know where you find spare time to do that, Secretary, but God bless you, and we're delighted to have you here. Thank you.
Good morning, everybody. It is a great opportunity to be with you here at Balcony. I'm sorry that we've kind of rearranged this visit a couple of times, but I'm delighted to have a chance to join you. And I particularly am delighted to be with you because we wouldn't be celebrating this great healthcare victory without those of you in Balcony and those of you in this room. And I think you need to give yourselves a huge round of applause. I want to thank Bruce and Joe Baker and Lou Gordon and a lot of your leadership team who have really been so focused on this effort. And I want to tell you that we actually at the national level have known about the great strides made here in New York for a long time, which is why we were wise enough to steal a lot of our new leadership team right out of New York. Dr. Tom Frieden is now the head of the Centers for Disease Control and Prevention. You got to work a lot with Tom here as the New York Commissioner. Rima Cohen, who is here with me today, Rima is my counselor on Medicaid and Medicare issues and a whole range of health issues, and many of you know Rima from her days here. Dr. Peggy Hamburg is the new Food and Drug Administration administrator and is doing a fabulous job. Luis Rosero is joined our public outreach office and is the Deputy Assistant Secretary for Public Affairs. David Hansel is our Principal Deputy Assistant Secretary at the Administration of Children and Families, working on the whole range of issues from TANF to early childhood education, to child care, critical areas. Farzad Moshanari is our deputy in the health IT area, and we just convinced Andrew Ryan to join us from the New York City government, and he is the Deputy Director of Policy at CDC. So we have, I apologize for taking away some of the leadership, but want to assure you that they will continue to work on efforts and benefit not only New York going forward, but the rest of the country. But I think it's a tribute to the kind of talent and the kind of vision that you all have. Dr. Jaime Torres, I think, is here. Is Dr. Torres here? Not yet. I think he may be joining you. But he has just been named as the new HHS director in Region 2, and hopefully you will get to know him if you don't know him. Again, I do want to thank you for your incredible active support of health insurance reform. You know, it's been said over and over in this country, the debate has gone on for quite some time, and when people would ask, when are you going to start fixing health care, we can finally say, starting right now. We are now at the point that we have an opportunity for a new chapter. And you know, when I think about the people who contacted me over the course of not only the campaign, but then over the last year and a half, I think about how this really is going to impact people. I talked to mothers who were in the midst of chemotherapy and had been told by their insurance company that they have run out of benefits, and so they're balancing life-giving therapy with the financial possibilities of bankruptcy because they can't pay out of pocket, and that will stop this year thanks to health reform. Parents with kids with pre-existing conditions, like Christine I was with in Philadelphia last week, whose son has a rare blood disorder. He's 7 years old. She worked for J.P. Morgan, had a great job. She lost her job in the downsizing due to the recession, lost her insurance along with the job, and she and her husband are totally terrified about their insurance predicament because she could not find a company who would underwrite her son in the plan. And again, that will end this year. Her son Alex will be able to be covered by an insurance policy. You know, a lot of the focus of the bill is about how much money we're spending, but what I like to remind people is this is a healthcare system where we have spent year in and year out over $2 trillion each and every year, but we continue to spend more, live sicker, and die younger than most developed countries in the world, and I think that also will come to an end because we really have an opportunity to move forward. Now, New York has been ahead of the rest of the country when it comes to giving people basic health care and community rating, buying insurance. Excuse me, see, pretty good sneeze. Chuck Todd should be so good. But you all have presented a prototype that I think is worthwhile following. You also pioneered the initiatives of kids being able to stay on parents' policies. I can't tell you how many people have contacted me already saying, this is amazing. We went through that same situation with our two sons when they graduated from college. They both were going into situations where they didn't have health insurance with their post-college adventures, and luckily they were healthy, and we could find single policies for them on the marketplace, but they had friends who weren't. And I watched these kids who were thrilled about college graduation, but suddenly struggling, and their families struggling with trying to find insurance coverage. And in fact, in one of the cases, one of my son's very good friends who had some pretty serious illness earlier in his life, he's now healthy, but the dad said, the good news is I no longer am writing college tuition checks. The bad news is his health insurance is going to cost me as much as his college tuition did for a year. So we haven't made a whole lot of progress. And again, that's going to end for people across the country. Now, here in New York, I'm sure that there is some question about, well, if we've already done all this, what's going to happen here? How do New Yorkers benefit? And you've already heard a presentation about who's still uninsured here, and we can, the framework of this bill is certainly going to make that easier to cover the still uninsured. It will expand the footprint of community health centers. Tax credits will be available this year to small business owners to help pay for employee coverage. Again, that's a story I hear over and over again where entrepreneurs, small employers say to me, we want to do the right thing. Our employees are like family. We want to provide coverage, but we have two choices. Our rates continue to skyrocket because we don't have any leverage in the marketplace. If we have one employee who's a cancer survivor or heart attack survivor, our rates are quadrupled automatically, and we really get penalized.